Hello and welcome to our webinar today. I'm Gary Jesse. I'm a Senior Vice President for Sellers Dorsey. I have the pleasure of leading the national consulting practice, and we support states, managed care organizations, providers, and solution partners across the country. Excited to be with you today and facilitate an important conversation highlighting two companies that are offering mitigation solutions to state Medicaid agencies as they commence efforts to return to normal operations as COVID-19 public health emergency ends. Over the course of the COVID-19 public health emergency, state Medicaid agencies adopted many flexibilities afforded by the Centers for Medicare and Medicaid Services to be able to respond effectively to the pandemic. This included changes to modifying eligibility requirements and benefit packages, ensuring access to needed services, supplies, and providers, and supporting healthcare providers by updating payment rates. Today, I'm excited to welcome Matt Salo from Salo Health Strategies, who's also a former founding executive director of the National Association of Medicaid Directors, Lexi Gervis, who's the vice president, impact and director, public sector and NGO engagement at SteadyIQ, which is a leading provider of 1099 and gig information verification. And last but certainly not least, Karen Shields, who's a Chief Client Engagement Officer for Gainwell Technology, and who has held several former leadership roles at the Centers for Medicare and Medicaid Services. The discussion today will highlight solutions states may want to consider as they look for additional resources and solutions to meet the unprecedented work associated with the eventual end of the PHE. The goal is to look for solutions that minimize the burden for state staff and certainly the beneficiaries. Before we hear from Lexi and Karen today, I'd like to turn it over to Matt to give an update on the current state PHE unwinding landscape. Matt?
All right. Thanks so much, Gary. It's great to be here, and I love working with Sellers Dorsey. So I think at this point, the public health emergency is actually over, but we're not quite ready to hang the mission accomplished banner just yet. And in fact, the hard work of unwinding the public health emergency is only just beginning. And I say that with a little bit tongue-in-cheek because it began months and months and months, if not years ago, for this eventuality. But before I talk about kind of what's next and the work that has to happen to make sure this goes off smoothly, I do want to make sure that we pause and reflect and celebrate the role that Medicaid has played as a first responder for this country through the last 3 years. And Medicaid does that, and it's done that historically. Natural disasters, man-made disasters, economic downturns. Medicaid is there to protect the physical, the behavioral, the social, and the fiscal health of Americans and of this country. And so I think we just need to appreciate that and celebrate it for a job well done. But what that has meant is that over the past couple of years, the Medicaid rolls have grown from around 70 million people pre-pandemic to more than 95 million people today. And so what now has to happen over the course of the next year is every state Medicaid program is going to have to redetermine the eligibility of all 95 million of those individuals. And best case scenario, nothing goes wrong, no error, no human systems or whatever error, we're going to see 15, 18 million people lose Medicaid coverage. And that will be disruptive to them, to their families, to the system. And that's something we're going to have to address and grapple with. But I think the key task for state Medicaid directors and their partners in the MCOs, their partners with community-based organizations, and their partners with stakeholders across the system is how do we minimize the number of errors that can happen? And how do we ensure that the process of that redetermination is going to be as seamless as possible? And I will say from my vantage point, when I was with NAMD and now, the unwinding and the Medicaid redeterminations have been issue priority number 1, 2, and 3 for every state in this country and every plan and every stakeholder. This is important. This is our moment, and states are really trying to step up to meet the challenge of this moment. And just I'll kind of close this by saying there's so much that needs to happen. There are going to be workforce challenges in the states. Do you have the manpower to do the eligibility determinations effectively, efficiently, accurately? Do you have the systems in place to process 95 million people whose information has changed multiple times over the past couple of years? Can you navigate the politics of coverage and the financial repercussions of what's going to happen? And then finally, and perhaps most importantly, is how do we actually go about engaging the 95 million Americans, many of whom have moved, many of whom have had their life situations changed, many of whom have had their incomes changed, and none of whom have really been forced to engage with the state Medicaid agency on an eligibility level since the beginning of the pandemic. And they're going to need to. And so it's really incumbent upon all of us in this under this great big tent to figure out how are we going to reach out, engage, and ensure that that engagement is effective, efficient, and accurate, so that we can minimize the downfalls of errors and ensure that people are going to get and keep the health insurance that they are entitled to. So a lot going on. Looking forward to this conversation. I'll turn it back to you, Gary.
Thank you, Matt. I couldn't agree more. I think it is really an unprecedented time, and I think you've described all of the potential partners, and all of them have a role in supporting the beneficiaries who really find themselves in the middle and really unclear about what these changes even mean. So I also just echo that the role of Medicaid director in trying to balance all of these challenges within a state, and in addition to all the other challenges that face states, it really is a huge lift, and that's both with the Medicaid agency and the eligibility agencies, and partnering together to make this happen. So thank you for your words on that. I want to turn it over to Lexi. And Lexi, if you would share with us how STEADY is approaching PHE unwinding.
Yeah, thank you so much, Gary. So happy to be here. Thank you to Matt and Karen as well. Excited to share the space and talk about this today. I think I want to pick up actually a little bit on what Matt ended with, which was around changes in income over the course of the pandemic. And I think that's really where we come in, right? So, as Gary mentioned in the introduction, we're the leading provider of 1099 and gig income verification. And I think pre-pandemic, we knew that this was an important workforce, but post-pandemic, it's a crucial one, right? We saw a lot of people move from W-2 work to 1099 work during the course of the pandemic. So they might be verifying for the first time during this redetermination process with a very different type of income stream. So I'm going to actually back up a little bit, just ground us in who these workers are and why it's really important that we serve them. If this was really interactive, I'd give a poll, but I don't have quite the audience to do the whole poll with, so I'll just share it. Typically I ask, out of those with incomes 200% below the federal poverty level, how many of them have non-standard or non-traditional work arrangements? And normally I'd give a range, 10%, 20%, 30%. It's actually over 40%. 44.4%, the Urban Institute found 44.4% of those with incomes 200% below the federal poverty level report non-standard arrangements. And actually 1 in 3 report that as their main job. So these are really people on the low end of the income bracket. And then I think the other important piece of this information is because of the nature of their work arrangements, they're least likely to be covered by an employer. So if you have, if you're an independent contractor or gig worker, have 1099 income, you're not required to actually be covered by your employer. So Urban Institute also found that 80.9% did not have employer provided healthcare coverage. And I think the intersection of these 2 points is crucial, right? So these are folks with very little incomes who are least likely to be covered by their employer, and thus most likely to need to be covered by government subsidized healthcare, Medicaid, CHIP, et cetera. So I think that's to point the way to how crucial it is that they get covered. I think where we come in is how often they struggle to get covered, right? And I think the big reason is because of verifying their income. So, again, by law, they're not required to receive a pay stub. 1099 workers receive a 1099 at the end of the tax year, but they're not receiving weekly, biweekly, monthly pay stubs, right? And that means that, the most recent documentation they have of their income is their tax return from the previous year. And these are workers who have traditionally volatile incomes, inconsistent. So tax return information is really out of date. And they're being asked to provide more up-to-date information, and they don't receive that kind of information from who employs them, or they're self-employed. This means that there's a really burdensome process to prove their income to the state. And on the state side, it's a really burdensome process to try to understand their income, right? There's not a database you can ping that has this kind of income. So state caseworkers are kind of stuck in this kind of manual process and asking for more documentation. So I think this all comes to a head. I'll wrap this up, but this all comes to a head with the PHE unwinding. You have a big group of the workforce moving into this kind of income, and you have some state caseworkers that might be, this might be the first time they're actually verifying people, right? We know that they brought on a lot of new folks, and this is not traditional income that they understand how to verify. So we think that verifying this kind of income for these kind of workers requires a real paradigm shift and should not rely on old documentation. So what SteadyIQ has done is built a user permissioned, real-time verification solution that allows workers to connect to their gig platforms, to their deposit accounts, and show their income. They understand what their income is, they select it, then they actually send it to the state to be verified. The state gets a standardized, easy to read, up-to-date, real-time information, PDF of their income. And we think this is going to be, potentially a crucial part of the unwind to be able to verify these workers and have standardized documentation to do so.
So Lexi, I have a few questions for you, and that's very interesting. And thank you for the background. And
Sure.
I think everyone on this call, on the video, could not agree more that, things are so different than they were pre-pandemic, and really innovative solutions are the only way we're going to get to the finish line. But could you tell us why might non-standard or 1099 workers, why they could be a particular bottleneck, and what are the administrative issues in the context of the unwind for this group?
Yeah, absolutely. It's a great question. I think the biggest issue is that this is a workforce that cannot be cleared ex parte. There's no database that you can ping that holds their information like you do with W-2 income, where there's a record and there's recent pay stubs. So, we know that CMS is asking states to clear a significant portion ex parte, and we know definitively that you can't clear these workers that way, right? So that means already the first snag in the workflow is, okay, no ex parte. I think the second one is because there isn't a database you can ping, it's also really hard to make the, even the redetermination process outside of ex parte to make that quick, because these workers are often going to end up in a kind of manual review situation that might require asking for multiple documentation. If it's already hard to get in touch with these workers, as Matt was mentioning, like the issue of people moved, right? People might not be responding. The idea of that is daunting for a state, right? Potentially trying to reach someone to gather multiple documentation, and we think that represents another snag in the workflow, because there isn't an easy way to get this data. Really, these data have to come from the workers themselves in this case. And then I think the last thing about that is it could be a significant source of churn, which we know is CMS's yardstick or metric for the success of the unwind is how many people stay covered. And if someone was doing W-2 work, they moved to 1099 work during the pandemic, they don't know how to verify, states don't know how to understand their income, that could be a source of churn. So on the front end, there's all this administrative burden, and on the back end, there's the potential for real churn.
That's incredibly helpful. So along the same lines, what lessons can we draw from the pandemic around a non-standard or 1099 workers, and how we're supporting these workers? Like, what do you believe might be most relevant to state Medicaid directors and directors within eligibility systems across the country?
Yeah, absolutely. And I think this is a little bit of like, oh, we've been here before, right? So the pandemic started. These are workers, again, by the nature of their work arrangement, they're not eligible for traditional unemployment insurance because they don't have an employer paying it on their behalf. policymakers realized this, right? Kind of a few months into the pandemic, understood that they weren't being covered, and there was a real political will to make sure that they were. They passed a lot of CARES Act relief, and part of it was pandemic unemployment assistance, PUA, which made these workers eligible for unemployment for the first time. But labor agencies were not at all prepared to verify their income, right? They hadn't done it before because these workers weren't eligible, and they were stuck with verifying income for folks that they'd never done it before. And again, the workers themselves weren't used to verifying their income. So they were sending, screenshots of Venmo payments and bank statements and, receipts on a piece of paper, right? Kind of putting together all this disparate documentation. And state agencies were totally overwhelmed. And the result was kind of the very public firestorm that we saw, where workers were waiting 16 weeks and more to actually receive their unemployment benefits. And agencies had intense backlogs. And at the same time, fraud was running rampant, right? This was a system that could be taken advantage of by bad actors because there weren't systems in place to verify their income. And that's actually really our origin story. That's where Steady IQ started. We saw this issue. We'd been working with these types of workers for many years before, and we realized this was a moment to build a solution to help them verify, in this case, for unemployment benefits. But now we've seen the opportunity outside of this. But I think, when we heard of the PHE unwinding happening, we were seeing parallels between this kind of pandemic unemployment assistance, the public shame that a lot of agencies went through, the issues that workers went through, and seeing a little bit of a parallel to the PHE unwinding if you're seeing a massive increase in this type of work. So, that's kind of why we're out there evangelizing that there's a solution in place to verify these workers that could help your workflows and really prevent that kind of situation from happening again.
Yeah, and thank goodness for your forward thinking and the development of this solution. My last question for you, and I know you've touched on some of this already, but why do non-standard or 1099 workers require a different workflow solution to be verified? And why is it important that states have solutions like yours in place for the future?
Yeah, and this definitely is what we covered, and I'll give some of the highlights. So, again, not required to receive a pay stub by law. They self-report their income. Tax returns from the previous year are often out of date, especially with inconsistent and volatile income. So you might be making the wrong determination. And then the process is burdensome for both sides of the equation, both for workers who are trying to verify and for state agencies. What they need is a solution that allows workers to do this quickly. So in our last deployment, people could actually complete an income passport, our income verification solution, in under 10 minutes. So that's really speedy, really easy, better than going through reams of documentation. And it cut the time for state caseworkers to actually review that documentation by a third. Sorry, by 2/3. It took them a third of the time. I want to get that, make sure I get that stat right. So again, that kind of speed is crucial. I think why it's important for states to know about having solutions in place for this moving forward is that the predictions are that this type of work is only going to grow, right? So it's 1 in 3 workers today. Economists predict that in a few years, it might be half of the workforce, and every kind of recessionary event sees an uptick. So the last big uptick of this kind of work was in the Great Recession in 2008. We saw the same kind of uptick during the pandemic, but then it stays. There's a lot of stickiness around that. So we believe that, working outside of the traditional W-2 arrangement is only going to grow, and that states really need to be prepared to serve those workers.
That's very helpful. Thank you, Lexi, so much for joining us. Matt touched on this just a little bit, but, not in addition to 95 million people trying to work through this eligibility process, it's just we know our state partners are facing unprecedented workforce challenges within their Medicaid and eligibility systems across their whole systems. And so, you think of this workflow, you think of the gaps in terms of staffing, and it just becomes a no-brainer that you have to implement innovative solutions to be able to make these things work better. And states have been pioneering these efforts for decades, but at the level of workflow and the amount of challenge that's facing them, it's really an important conversation that we're having today. So Karen, I'm going to turn to you next. Gainwell is the #1 provider of Medicaid services, more than 50 years of experience. Can you speak to the broader array of solutions that are available from an eligibility systems integrator?
Yes, absolutely. I will say that one of the things that excites me the most about Gainwell is its footprint within the Medicaid ecosystem. We don't just do integration and data analytics, which I think, and claims, which I think a lot of the industry knows us for, but we also have a very robust offering specific to this time frame in Medicaid history. And so I'm going to start with what my role is. And my role in Gainwell is Chief Client Engagement Officer. And one of the things that I am very honored to be able to do in this role is go around and actually visit state leaders that run Medicaid programs and are responsible for delivering to this population and just ask them, what do you need that you don't have? And the answers to those questions, both last year and currently, have put us in a position to be able to respond to the Unwinding event. And I'll also say that added to that, one of the things I constantly say when I talk to people and engage with them and do some co-mentoring, meaning they mentor me and I have an opportunity to share my experience with them, is in my experience at CMS, when I worked with the group in CMS that is responsible for healthcare.gov, one of the things that we constantly designed and developed solutions around was something that we called consumer confusion. There was a very direct correlation between the amount of absorption of the complexity associated with healthcare coverage and all of the things that are responsible for helping someone go from a need to actually being covered, and all the barriers there. Consumer confusion was one of the biggest things. And so Lexi talked about it and Matt talked about it. And Jesse, you talked about it. And that is, what do I need to do in order to not be in a position to lose coverage? And so reducing consumer confusion is one of the things that I believe Gainwell is most uniquely positioned to offer, especially to the more than 36 state customers that we already have as an incumbent relationship with. So the easiest thing to do is to reach out to us, to Gainwell, and say, can you help me with ad hoc call center support? That is our core competency. We have them in more than half of Medicaid states, and we operate those call centers right now largely for provider enrollment. But we have the capability customized specifically for Unwinding and the redetermination event to mobilize and provide automated solutions and AI to help engage people more accurately, more quickly, identify when there is a high level of confusion, and reinvent and continuously improve the way we are communicating with people who are stuck within this, let's face it, this knot between I've got a notice and I need to do something. Also, an opportunity to create an alert system that helps them understand when the clock is ticking down for them to respond, so that they know what the guardrails are for their ability to create an engagement with the state to consummate their enrollment. We also have access to data across states. So one of the knots in this complex casework that we find between states is those who have moved from one state to another. There was a great migration within the Medicaid community, not just within the Medicaid community, but across the country during COVID, where people found the need to co-locate across state lines. And so someone who enrolled in one state, but now lives in another state, and the state where they enrolled may not have gotten the memo that this person no longer lives here. And the person who moved to a different state probably didn't understand that they needed to let the Medicaid state know. So there's a lot of communications that have happened. Matt talked about the fact that preparation for this event has happened both within the federal government and within the states for years prior to this happening. However, one of the things that you really can't be as forward thinking as you want to be, is communication. Because if you communicate too early, people act in a way that you're not ready to do something about, right? So there was a whole lot of time where the Medicaid agencies didn't know when the public health emergency was going to end. They didn't know when they had to start the unwinding practice. And so once that was known in December, plans were made. And so now you have this population of 95 million people who are faced with understanding in phases what they need to do. And so one of the things that Gainwell has a core competency in and is ready to mobilize and support states in is helping all of the people who are going through this unwinding gauntlet know more about what they need to do when. And that is with mobile solutions, automated systems, call center support that could just basically serve as the triage agent that helps people have a helpful engagement contact with something that tells them what to do next. There are a number of states who have already put tens of thousands of people through the redetermination phase and have had a high termination rate as a result. And one of the things that I can tell you from my own personal lessons learned working with healthcare.gov during a very short enrollment period is that reducing confusion and getting someone to talk to as soon as possible is a very, very significant preventer of loss of termination, especially for someone who is eligible. Alexi talked about the fact that one of the criteria for excellence and for being in a place where we come out of this unwinding event with the least amount of uncovered citizens is, how many people who are eligible don't lose coverage, and how many people who are eligible for maybe one of the state-based or the healthcare.gov exchanges find access to coverage if they're eligible. And then the communication and the support model around the country, faith-based organizations, community organizations that help people understand that it is important to be preventive in a way associated with insurance and coverage, more so than has ever been in the past, especially as we get to a point where this country is ending the national public health emergency. And so some of the benefits associated with the PHE, which included access to vaccines, access to testing equipment, will no longer be as available as it was before. Making sure that people know. So communications, automating support in an ad hoc call center way, also having access to data across states so that you can create a complex casework support model for people who are kind of caught between Medicaid, private healthcare exchange access questions, eligibility questions. All of those things are where we are finding states reaching out to us and saying, could you help us solve for these things? And we have engines and we have support models ready to do that. Matt talked about earlier where this is a time where the country has to lean in together to meet this moment. And Medicaid is a system, right, an ecosystem that has always had to respond to create a safety net for the most vulnerable population that we have. And so Medicaid directors, state health agencies, leaders, governors, everyone who has mobilized a task force, we encourage them to reach out to all of the partners who already have relationships and say, here's the gap that I have. Can you come up with a solution to solve for? I think that they would all be surprised that there are partners like Gainwell who have camera-ready solutions to help them, including the ability to assume a very complex training requirement. I think when I talk to states often, I hear them say that they are concerned about how complex eligibility is and how hard it is to get resources trained and ready so that they can create an accurate enrollment process for their state, right? The ability to quickly create an AI-based robotic training engine is something that Gainwell has, and we have partners who we can bring to bear to develop and deliver to a state a body of resources who are actually able to be of immediate value to a state to reduce queue times. And so reducing queue times, reducing confusion results in less people who are unenrolled and eligible for coverage. So those are some of the things that we are working on at Gainwell and have been responding to, and are very excited to be a part of this historic event and to be a solution to both the partners that we already have a relationship with and those who we look to.
Well, your passion definitely shows through, and it's great to know how we've heard from Lexi, but to hear from you, Karen, as well about how partners that are really helping to carry this burden for states are stepping up to really create additional pathways. And I think one theme of the call today, starting with Matt, is that we're all in it together. And, anyone who views this video, you become an ambassador and really assessing the role that you play in the Medicaid system, whether you're an advocate, a provider, a managed care plan, a state, or you're just somebody who's interested in this system of care. It takes all of us to make sure that people are supported in a meaningful way. And as you said, there will be people who ultimately will not have coverage in Medicaid, that perhaps don't even need that coverage in Medicaid any longer. But for those people who desperately need this coverage, the failure to make sure they know what's expected and how to get through this process is really one that is really on the minds of all of us. So Karen, I have a couple of questions for you. The first one is, we've talked about potential, everywhere you look, everybody's talking about, doom and gloom and all the challenges associated with the unwinding of the PHE. But what would you say are the positive impacts you expect to see out of the PHE unwinding?
Oh, I love that question. I love it because I am a very firm believer and have seen evidence that there is always opportunity, specifically in the innovation space, for a program as large as Medicaid to find a pathway forward that they've probably never thought of before. So if you think about the difference between some of the major programs, specifically those that I have exposure to, the ones that CMS has governance over, Medicare, Medicaid, and the healthcare exchanges, the urgency of the moment and the fact that everyone is paying attention to Medicaid in a way that hasn't happened maybe since it was signed into law in '65 is a really huge deal. And so my belief is that anything that you pay attention to and you have positive intention for, you look at it long enough, you're going to come up with ideas. You're going to come up with people who care enough about it to think of things in a new way. And Medicaid is way overdue for all of that kind of energy, not just from the leadership, but also from private investment and also from anyone who has an R&D budget. Anyone right now who is paying attention to this going on is trying to figure out how can we help Medicaid be better at their jobs. And that is always a good thing. The second thing is, when I was back at CMS, one of the conversations I remember having amongst those of us who kind of, talked in the around the water cooler was, this is the first time in a long time that the federal government, the state government, and healthcare plans are all aligned towards one common goal, and that is keeping people who are eligible covered and finding coverage for those who are unenrolled. And then you add in the unprecedented partnership of the healthcare exchanges, right? So now you have the healthcare exchanges and all of the people who have built the engine around eligibility and enrollment for the ACA. You've got all of the Medicaid energy behind the redetermination. And then you've got the managed care plans who are also using all of their technology, their communications, and all of their process engineering to create a safe space for 95 million people. Nothing but good things can happen in an innovation space when all of that energy is geared toward this population. So that's one of the biggest things. Like, I just really want to keep all of the passion going, all of the focus on Medicaid. I am a zealot for Medicaid. I believe the federal state partnership is an amazing thing, and the checks and balances that exist there make us better. And then you add in, like I said, healthcare.gov, you add in community and faith-based organizations, and you add in the managed care plans, all working together. I believe that this will accelerate innovation, creativity, and all, and really good things we'll see happen, and for a long time to come, past the end of the redetermination event.
I agree. I absolutely agree with you. My next question for you, Karen, do you have any advice for states to find technological innovation solutions to address their challenges? You've mentioned a number of them that Gainwell stands ready to provide, but what advice would you give?
Yeah, so this is also a question that I am passionate about, because I believe that there is a responsibility for public leaders to be the change that they want to see in their programs, right? And each of us have an accountable, each of us have a social contract, not just those who are in public service, but those who are in private industry, and all of us who are citizens. We have a social contract to do the best we can and bring our highest selves when it comes to an event like this. What that means, though, is that you're going to have to make some space. And this is my own personal experience as both a leader in public service and a leader in private industry, to find out what is out there that you don't know. So you kind of have to be your own researcher. What does my state need that it doesn't have? And what is currently being developed that could be a future solution for us? Now, when I go and visit states, the number one thing I hear from them is, we need more of this. We need more attention from private industry. We need more applications and solutions developed for Medicaid. And then when I say, but how would you like to receive that? And what way? Like, do you even have bandwidth to get a demo, to get in, have a salesperson show up? And then then the shoulders come up, right? In this body language. But I get it, because I was the same way when I was in the federal government. But what I know is that we have to continue to find ways to have more conversations about what Medicaid needs and what private industry needs to work on designing for Medicaid. Medicaid is a national program that needs way more attention from an enterprise level, more national solutions, more customized solutions built specifically for Medicaid. And so my advice would be the same advice that was given to me when I was in the federal government, is make time to be a researcher for your own needs.
That's helpful. And, considering one thing we always say, in Medicaid is, if you've seen one Medicaid program, you've seen just one Medicaid program. And states, as you mentioned, are on different timelines, and, things are happening differently in different states. But is there one solution you think could help states who may be struggling to address unwinding?
Yes, believe it or not. And so, first of all, let me validate something. When I was at CMS working in Medicaid, I not only heard what you just said, that if you've seen one Medicaid state, you've seen one Medicaid program. I've also seen it. I've visited at least 15 different states, and they are unique and amazing in their own way, in the way that they deliver services and just the culture that exists in each state. But one thing is consistent across all of the states, and that is the need to reduce the amount of confusion that exists for people who need to go through this redetermination process. And so if I had a magic wand and I had a wish, it would be that states came together and there was a solution that they implemented that allowed them to access resources to answer, provide call center support across more than one state, because that will allow the country to leverage a solution for the Medicaid program that doesn't exist just in one state. So let me be specific. A help desk, a triage call center, a complex casework team for Oklahoma, for Texas, for California, for Vermont, all operating out of one center, out of one technology center, customized with, any type of complex rules that are required to the state, but also allowed to leverage resources across the state. Most Medicaid contracts require that you only hire people who live in the state. I believe that in order for us to meet this moment, even if it's only something that you do during unwinding, we're going to have to use a little bit of our innovative thought leadership to get past that in order to reduce the confusion and reduce the queues that are just inevitable as we get to the middle, the bell-shaped curve that is inevitable with this unwinding event.
Yeah, and to that point, I mean, the same flexibility that got us to where we are now might be, some additional flexibility to help us work through, the challenge that's ahead of us.
That's right.
Thank you for your passion and your input. It's been a fantastic conversation today. I'd like to turn it over to Matt. Matt, you've been around a long time, and certainly you have been a mentor to so many Medicaid directors and have looked to you because you always had a sense of what was happening everywhere else. But I'd like to ask you, based on what you've heard and based on your experience, where do states go from here?
So, well, thank you for that. Where they go from here, like in the immediate term, and I've talked to a bunch of Medicaid directors from all over the country over the past 6 months or so, and the one thing that I've seen is that they have spent an enormous amount of time putting in place a number of different pieces to try to address all of what's going to happen. And when I talk to them, I say, okay, well, what else do you need? Like, where else can I help you, like, put an additional piece that you need? And they're all kind of like, we have prepared for all of the eventualities that we can see right now. We know, however, that life comes at you fast and life is full of chaos and some things will break down. What we don't have the foresight to know right now is exactly where, when, why, and how much those pieces, human, systems, logistical, political, whatever, are going to fail. But what we will do now is we are going to be hyper vigilant to watch and to make sure that all of our partners, plans, faith-based providers, community organizations, the media, are also watching to help us spot the early warning signs and to be able to lean in with surgical strikes of, oh, it looks like call center queue times are too long. Now we know what to do. Let's go fix that. Or, oh, it looks like, the pre-populated forms we were sending had no way for a person to correct the information. All right, we can fix that. So it's going to take a combination of all of the preparedness with continued and prospective nimbleness to be able to fix those problems as they come up, and to sort of say, just because I'm in, Florida or California or New York or Alaska, that I can see things that are happening in other states and say, that might happen to me too. Maybe that's coming for me in a month. And so to kind of leverage and lean into that. So that's, and I know that Medicaid directors and their teams and all of their partners are going to, like I said, there's no mission accomplished banner that's getting hung up. The work is beginning. The work is going to continue. And I really think that, just two other things that I'd offer up. One is, and I think we've heard this in this session, it's going to take everyone's help to lean in and to help reduce the confusion and help families and help individuals. But I would also say that I would be careful about not encouraging everyone to just kind of self-deploy, rather to work within the frameworks and the structures that exist. So if the state and the plans and the broad stakeholder communities have a strategic message, work with that message rather than sort of coming up with your own message and potentially creating more confusion. So work within the system, but yes, as much help as we can get is going to be vital. And then just the last thing that I would share is that, independent of how this all plays out, independent of how well the whole unwinding goes, there's going to be a really, really interesting policy conversation coming up where as 15 to 18 million people walk away from Medicaid after having been on it for a year, 2 years, 3 years, realizing it's a darn good program. And it has the benefit of not having premiums, copays, deductibles. And they're going to enter a world where hopefully the benefit package is good, but the sticker shock for premiums, copays, and deductibles in employer coverage, in the exchanges, is going to be significant. And I think that's going to create some really interesting conversations in this country about what really is the future of healthcare coverage for low income and middle income America. And I don't know where that goes, but I think it's going to be a really, really important conversation to have.
Yeah, I agree with you. Well, I want to thank each of you for taking time to join me on the video today, and your passion for this topic, and certainly your interest in what you're doing to meet this need of states, and all directed towards supporting the beneficiaries across the country who find Medicaid as their healthcare system is it's just so important. For those of you who are going to be viewing this video, we want to thank you in advance for taking time to listen to our perspectives. This is the first of many short videos we hope to produce to share state updates and highlight innovative solutions for states. If you want more information about those videos or the solutions, you can access our website at www.sellersdorsey.com for more information about the topics presented, including in this video. So again, I want to thank each of the speakers and thank you for what you've done throughout your careers each and every day to make this system a better system for all of the individuals who are part of it.